Christian Lindmeier is a spokesman for the WHO, and he joins us now from Geneva. Great to have you on the show. First of all, a question about China. Is it possibly bracing for a second wave of infections of coronavirus?
Well, obviously, we don't hope so. I mean, you still will have travelers coming back, and you still will have individual infections. But we definitely hope that they didn't open too early, so that we'll have a second wave of infections. But what it shows, and that's important, is to never let the vigilance down, never let your guard down. Even if things are looking to get easier in whatever country, but China for that matter now, don't let your guard down. Keep going with the simple protection measures, and don't risk another wave of infections.
On the simple protection measures, there's so much debate over whether to wear a mask or not. The US is reviewing it. Austria has made it compulsory. And yet the WHO, it's not clear. You've still, I think on Monday you said you shouldn't wear masks. The public shouldn't wear masks when they're outside their home. Why is there so much confusion?
Let me try to explain this. Wearing a mask outside your home if you're not infected means that you're taking away, at this point in time, masks from those who desperately need it. So we have a shortage of masks globally and nationally, whatever country we're looking at. Right now, we need the mask for those staff who need it desperately. That is everybody who's dealing with people infected, from medical staff to people doing home care, to maybe also police officers, to forces out there who at the border, anybody who's dealing with possibly infected people, also receptionists at the hospital, or if it's a supermarket, they need a protection if the supermarkets are still open, and.
Christian, if I could just jump in there. Christian, yesterday I spoke to a virologist from the UK who said, yes, you should be wearing just cotton masks, because these are his words. You wear one to protect the other person wears one to protect you. So
let me get in this. This was point 2 here of my point. So wearing a mask if you're not infected bears the following risk. If you're not used to it, like medical staff would be, and you saw it in your own reportage, the people walking on the street, if you try to adjust your mask, like you're not used to it, first of all, you have to put it on straight. Then you feel it, you try to adjust it. How long do you keep it on? Do you wear it for hours? You're itching your eyes. If you're trying to touch your mask or try to adjust it, you're grabbing exactly in the area where the mask might be, or the shawl, or whatever protection you're wearing might have the virus if you have it for a protection. So the using of masks has to go hand in hand, literally, with an increased hand hygiene, because if you're not doing this, the risk of infecting yourself by touching the mask and then itching an eye, or drinking something and lifting the mask and touching your mouth, this is higher than before. So if you use masks, and nobody's forbidden to use masks, don't forget that's wrong. But if you're using a mask, you have to use it properly. And this is the bigger issue about the general public. Nobody's used to wearing masks normally. So if you're using the mask, make sure you're also having hand hygiene with it. Otherwise, it could be counterproductive.
Okay. And Christian, we are very close globally to hitting that 1 million mark of cases. Is there, within the World Health Organization, any regret that things could have been done differently, or things could have been said earlier to avoid where we are right now?
The World Health Organization has been speaking very early on from a window of opportunity in your countries, in every individual country, to prepare your health system, to prepare capacities, to get your people and the public ready for this influx of the virus. We have been saying each and every day that the virus will come to your doorstep and you have to be ready for it. This means getting everything ready, from the system to medical equipment to capacities and so on and so forth. So we have been warning from the early days.
But no one listened. Why aren't countries ready? So many countries haven't listened, that they're not ready. And they haven't followed, say, South Korea or Germany, examples of countries that have been doing things that have very good examples.
Many countries have good examples, that's true, but on the other hand, no country has done it 100% most likely. This is why we keep warning, and this is why as an international community we have to continue working to preparing countries, and also those countries who have a lesser effective health system, a weaker health system, where we need to increase the capacity in all fronts to avoid that those countries who not yet have a big outbreak, that they get a big outbreak. So there's a lot of work ahead of us still. And yes, I agree with you. The countries, member states, everybody should listen and get ready and prepare better than we are already. We see a lot of good developments, and the announcements you just showed in your clips there were just very encouraging. But we cannot stop. We cannot let the guard down. We have to continue doing this.
Christian Lindmeier, thank you so much for coming on the NewsHour.